To San Antonio Living, and we've got some important questions and answers for you about fertility. A lot of women have problems becoming pregnant. Why? What do they do next? We have invited Dr. Francisco Arredondo with Reproductive Medicine Associates of Texas. You've seen him on San Antonio Living before. Thank you so much for coming. Good to see you.
Good to see you, Shelley, again. How are you?
Fertility, it's such a touchy subject for women because by the time they're contacting you, they're a little bit emotional because they're wondering why they haven't been able to get pregnant. But it's something that they've got to talk about, and you're the person to go to.
Yeah, well, we try to approach this exactly how you're mentioning from three different point of views. One from the medical point of view and the emotional, that sometimes physicians were not really very keen about touching the emotional aspect, and we at RMA of Texas, we really focus a lot of this, and in the informational. They do want a lot of information, so we try to cover these three areas: medical, emotional, and informational.
Let's talk about at what point women need to start assessing fertility and start asking questions. What kind of symptoms, causes are we looking at?
It's actually very, very simple. Number one is if a couple has been without any birth control method for over a year, and that female is less than 35 years of age, then they ought to look for some help through a specialist. Okay. If the woman is over 35 years young, then actually they need to look for help about 6 months after trying.
Really? Oh, yeah, because once that clock starts ticking,
yes,
I mean, it's true, it's honest. There's not a lot of time after 35, really, to be safe.
Yeah, and to be honest, it's not like a switch. It's not like a 35. It's actually, it starts gradually depleting all the way from 25 years old slightly, and then dramatically after 35.
Now, a lot of women wait, and they wait too long. Why are they waiting?
Well, has been one of the plus and minus of our society as we are evolving, and women have been pursuing careers and delaying childbearing. One of the trade-off of this nice evolution of society is that they delay childbearing, and then we have less young women trying to get pregnant, which increases their infertility.
When women come in to have a test to find out, an evaluation, I guess, and I'm sure there's a lot of worry, a little concern, a little poking and prodding. What is the basic protocol that they go through?
I am so glad that you point this out, because actually, you know, a lot of the people do not come to a fertility specialist because of fears. And it's so simple. There's only 3 valid tests, and they are very inexpensive. A lot of people put us out there that is so expensive. You need 3 tests, no more. Okay. You need something to test your tubes, which is probably a hysterosalpingogram. Okay. That most of the insurance will cover it. But actually, if you don't have insurance, it's at $300, so it's not that significant. 2, semen analysis, which is basically to count the swimmers, the Michael Phelps of all the little individuals there. So that is actually only $125, and is most of the times covered by your insurance. And 3rd, something to document ovulation, which could be a blood test, very simple. So you only need 3 tests, and with that you document 90% of all the causes of infertility. So a lot of people do not approach it just for fear, but it's really very simple.
That really takes a lot of the worry and the question out for me, because, you know, I think about fertility and then I immediately see $20,000, $50,000 come into my head. And a lot of women might not check for the fear of how much it could cost. Without insurance, a man and a woman can get their fertility checked for like less than $500.
That is correct.
That's not bad at all.
And actually, you can divide 2 things, the diagnostic and the treatment. And the diagnostic, as you mentioned, is very simple, and most of the times it's covered by insurance. And the treatment, you know, it's actually not as expensive as the numbers that you mentioned. A lot of people think that, number one, not everybody needs in vitro fertilization.
Right.
And in vitro fertilization is in the realm of $9,000, $10,000, not the 20s and 30s that everybody has in their head. So, but inseminations could be as cheap as, you know, $300. Wow. So it is.
It's affordable.
You
just need to ask questions. You need to find the right people. What would you tell our viewers who are looking for a fertility doctor or fertility clinic, because there's a lot to choose from?
Absolutely. I think that you have to go with somebody that works in a team. The idea that we are only a one-man show or one-woman show is totally gone. We are a team. And somebody that cares at the emotional level, at the medical level, and that actually encompasses the whole approach of a holistic view. For example, we have actually done very good alliances with the Texas Fertility Center for Acupuncture. So we approached that point too. The Dr. Poonan Sharma from the emotional point of view, and from the urological or male side, Dr. Case helped us out. So we have a very solid team, and I will look for somebody that is board certified and that cares all this. That is a board certified individuals, and there are some here in
You
town.
do have seminars too that you do on Thursdays that folks can come to get more information.
We have complimentary seminars that actually aim to dispel all these myths and facts, and it's every first Thursday of the month at 6:30 at RMA of Texas. 6:30 p.m. It's complimentary, and we have some hors d'oeuvres and some refreshments, and we do a presentation from the medical, the financial, and the nursing point of view, and the embryology point of view. So it's a good hour, and we'll give you a tour of the facility so you know what to see.
And if you are at home and you're watching this and you've had a failed in vitro fertilization during the last year, Dr. Arredondo is going to review your case, right?
Absolutely.
So folks can call you. You'll provide them with a plan of action. Just explain that you were watching San Antonio Living. You need some more information. Thank you so much. Appreciate it.
No, it is a pleasure. Thank you very much.
Good to see you. All right, guys, here's where you can find out more information about the Thursday seminars as well. RMA of Texas, world-class fertility care on Stone Oak Parkway. Go to the website, rmatx.com, or call 210-FERTILE. Very easy to remember, 210-337-8453.